How does it feel in the immediate postpartum period? Hello everyone, this is Dr. Santoshi Nandigam. I'm a consultant obstetrician and gynecologist. Welcome to my YouTube channel. So you have just given birth and you think it's all over, but I'm pretty sure you're not ready for the following symptoms or the signs that I'm going to talk about. Number one, it doesn't end with the birth. You are going to feel little crampy abdominal pain, especially when the uterus is contracting and when you're feeding the baby. Now this is a natural mechanism for your uterus to control the bleeding. These are called as afterpains and they do last for about 2 to 3 weeks until your uterus is completely involuted. Number two, your nipple is going to crack if the latch is abnormal. So make sure you learn how to latch the baby best. And if your nipple is cracking, the first thing that you should identify is the position and latching of the baby. Number three, it feels like an achievement when you pee. The first time you pee after you give birth, it does feel like an achievement. And for some women, they may have certain inhibitions. That is, they may not be able to pee immediately after delivery or even after a couple of hours. See, our bladder is the most conscious organ in the body. If we are in environments where we cannot use the restroom, we tend to hold it, right? You have just given birth, your baby has just come through the vagina. It had literally pressed on your bladder and then came through the vagina, right? So it's okay even if you're not able to pee immediately after the birth of your baby. Some women might even require continuous bladder drainage called as Foley catheterization. May require some kind of help to drain the first urine. So don't worry about it. It's okay if you're not able to pee. If you're able to pee, it's fine. Your bleeding is good. You'll be shifted to room. Fourth point, it does feel like an achievement, the first poop when you deliver, because so most women ask me this question that, doctor, you've just given me an episiotomy. There's a small cut, right, which you've given to deliver the baby. So is it involving my motion passage? Am I going to be able to normally poop? It's not related or it's not close to your motion passage, which is completely different. And yes, you will be able to poop, but it's completely all right to feel constipated immediately after delivery or in the first 2 to 3 days after delivery and taking certain laxatives. So don't worry about it. Number five, lactation is a lot of work. It stresses you out. It sweats you out. It gives palpitations. You tend to get a lot of night sweats and you tend to develop a strong body odor. And women tend to be so hungry when they are lactating. So if you forget to watch yourself on the diet that you're having during your lactation period, you're going to gain an enormous amount of weight, which will be extremely difficult for you to reduce after a couple of days or a couple of months for that matter. So your exercise is also as important. And after a normal delivery, I usually advise my patients to take a 4-week break and resume their exercises. And after a cesarean, I usually suggest my patients to take a 5-week break and then resume their exercises. Thank you very much.